Can you start by just sharing with folks what it is you do and a little bit about your background? I know you previously worked at Microsoft
Sure.
and how that led you to healthcare.
Sure. So I'm the Chief Information Officer here at Providence. So anything system related, my team does. It could be everything from Epic to our financial systems, network and infrastructure, user access, business intelligence, a lot of innovation that we'll talk about today, what we're doing with artificial intelligence and whatnot. And I actually took on an additional role of real estate and facilities. So I'm actually wearing both hats here at Providence. And that's because we really see a merging of virtual care and our physical facilities, as well as remote working and how we use our space in a more collaborative way. So it made sense to combine those teams. As far as my background, I was at Microsoft for 27 years, a lot of different roles there: finance, operations, IT, Windows. My last role was on the Azure team there. Microsoft, fantastic company, but after 27 years was ready to do something different. And when I looked around, there's nothing that is more important to our lives than healthcare. And I think healthcare is right for a digital transformation. So taking my tech background, applying it to healthcare just felt natural. And, obviously giving back to our communities, the way we deliver health and can improve healthcare of those communities. So it was a natural fit of my background and the industry. It's been 2 years, and it's been an interesting 2 years to join. It's been a good ride.
Yeah, for sure. And nobody told you 1 year in you'd be in the midst of the first pandemic of our lifetime, right? So let's start, BJ, with what you mentioned, which is this kind of morphing of the relationship between real estate, innovation, and delivery of healthcare, which not just traditional post-acute care, but now, ever since the passing of the Affordable Care Act, which has been more than 10 years now, there's been a drive to provide more acute level care in the home, whether it's a caregiver, whether it is self-administering, or whether it's technology. And I know you're really playing a large role in and sometimes leading that effort. And you mentioned it also relates to real estate. So can you cover those topics for me?
Sure. Let me give you some context. So, a year ago at the beginning of the pandemic, the big worry was we didn't have enough PPE and we thought our ICUs would be overwhelmed. And so as a health system, we immediately looked at it. How could we manage, both of those, very valuable resources? In the case of hospital beds, we looked at, there was a number of patients that could receive great care from home. And so, at the peak of the pandemic, we had 1,000 COVID patients that we actually sent home and were remotely managing. And that was done through technology. And so we see in a post-COVID world, acute care and other care delivery in the home becoming more and more important. In the time of COVID, we kind of made do with the technology we had at hand. But, now that we can be more planful, emerging technologies like Internet of Things, wearables, uploading that data more real time. So, our caregivers, our nurses and docs, and more importantly, artificial intelligence can monitor a patient, in real time and then pull in the caregivers, as needed for that remote care.
What I want to make sure that I point out about what BJ just shared is it's not just great news that you don't have to be hospitalized for things that don't need hospitalization anymore, whether it's a readmission or just an unnecessary admission. We call that an avoidable admission because you can just be monitored at home. But it's also the process of the fee-for-service era, which is the name of the reimbursement model prior to the Affordable Care Act. Whereas ER doctors and hospitals were kind of trained to take the high road and be safe. Hey, we can't send this patient home until we observe them or check them out. And so it's not just delivering better care, but it's an undoing of the old model to a better model that's more affordable and there's less waste. So that's really exciting.